Environment and Water Resources, Honorable Tunji Bello. Director of Water Resources. Civil Society President. Executive Secretary, Lagos State Water Regulatory Commission. Development partners here present. Council managers, MOH present, and HODs. I am delighted to welcome you all to the occasion on behalf of the good people of Ojudu Local Council Development Area. Our utmost gratitude goes to our donors, partners, progress. WaterAid and Kimberly Clark-supported WaterAid LCDA out of the 57 LG and SDA within the state to be part of the foremost launch of this highly beneficial. According to the 6th article of the 17th Global Sustainable Development Goals, the United Nations seeks to ensure safe drinking water and sanitation for all by focusing on the sustainable management of water resources, wastewater and ecosystems, and acknowledging the importance of an enabling environment. Therefore, this gesture will afford the good citizens of the LCDA the opportunity to enjoy all the benefits and the projects will provide, such as the availability of hand washing facilities and hygiene kits in public facilities such as schools, community centers, primary health centers, facilitation of large-scale hygiene provision in peri-urban and remote rural communities and more. All these are in tandem with the Lagos State scheme as captured in Mr. Babajide Olushola's team's agenda for the state. Likewise, our administration has been relentless in uplifting the living standards of the citizens through our own AIDS agenda: health, education, youth empowerment, and social infrastructure. As our focal driving factors, the impact of this intervention, therefore, will go a long way in boosting our commitment and morale to do more for our people. Talking about commitment, the administration takes the health and well-being of our people as a priority. This prompted us to embark on the overhauling, rehabilitation, and upgrading of the 7 primary health centers within the LCDA. Some of them are providing 24 hours, not some of them, 3 out of the 7 are 24-hour clashes with the availability of competent personnel and world-class equipment. We would love to do more for the benefit of the citizens and residents of Lagos State. Permit us to ask for more, like all of this. We look forward to your support and bigger projects for the good of our people. It is our prayer that our donors shall all be tremendously recompensated, even as we promise to put everything that we provided to optimal use with adequate maintenance. Thank you, and God bless.
CDA.
I would love to stand on the well-established protocol led by the director, my very good brother, my colleague. I think I need to give honor to those the honor I did. The representative of the PKS, I'm Director of Water Resources in the country director of WaterAid Nigeria, Mr. And my very good sister, the EA, Lagos State Water Regulation, our home, Mrs. Funke Adepoju. And my colleague, my brother, the mayor of Ojodu Local Council, and all of our pipeline in progress in the local government. Council manager, the head of the head, all the HOA, and of course, all the staff from the Ministry of Environment and the staff from Ministry of Local Government, the NGO present, and everybody, the photographer, the gentlemen of the press, I welcome you all. I'm delighted to address this gathering today. It is no longer new that we are here to launch the WaterAid Kimberly Clark project, which is about sanitation and hygiene wash. It is indeed a great opportunity for a local council to be one of the 2 local councils out of the 20 local council, 37 local council development area to benefit from the various opportunities presented by this project. On behalf of the entire resident of my local council, I say a very big thank you. Whereby the numerous opportunities offered by this project and your confidence in my local council, I want to assure you that this opportunity will not be taken for granted. So be assured of our cooperation and necessary support. Water, sanitation, and hygiene being one of the social development goals which Nigeria is signature is not only critical but also a basic human survival requirement and so must be taken seriously. Access to sanitary and water facility is critical for everyone, irrespective of the social status of the individual. It is therefore our hope that this project will achieve set objective at the end of the day. Permit me at this point to reaffirm the commitment of the local government, Ondo North SCDA, and the good people of my local council to ensure the success of these projects across all sectors of the local council. I'm very sure officials of WaterAid will attest to the support of my local council since the commitment to date. This, I'm sure, will continue. This address will not be complete without thanking our amiable Governor Babajide Sanwo-Olu, for his commitment to the team agenda. Thank you, Mr. Governor.
In the room, such a full house, and I feel like I'm in the midst of friends. When I look to my left, I look to my right. So, really much excited about this. Your Excellency, the Executive Governor of Lagos State, Babajide Sanwo-Olu, the Honorable Commissioner for Environment and Water Resources, Honorable Tunji Bello, representative of the Permanent Secretary, Ministry of Environment, Executive Secretary, Lagos Water Regulatory Commission, development partners, civil society partners, distinguished ladies and gentlemen, members of the press. It is our honor and pleasure to welcome you to the launch of the Sanitation and Hygiene Improvement Project, which is aimed at improving maternal and child health outcomes in Lagos State by improving hygiene behaviors amongst vulnerable population in Ikorodu North and Ojuju Local Council Development Area. The project is expected to reach 45,000 people with improved sanitation and hygiene services over the course of 2 years, and will focus on healthcare facilities and key community touch points with particular attention to the health and well-being of women, children, and school-age girls. Nursing mothers and children are especially vulnerable to the impact of poor hygiene and lack of access to clean water and adequate sanitation. Unclean pests and infections are a major contributor to both maternal and newborn mortality, and the containment of household environments and risky hygiene practices accounts for almost 30% of the total burden of diseases in developing countries like Nigeria, with under 5 being particularly at high risk. Diarrhea diseases are the second leading cause of death among children under the age of 5, and around 70% of these diarrhea episodes occur in low-income middle countries, maybe by foodborne or other diseases associated with unhygienic practices, while also nearly 90% of all diarrhea deaths are linked to unsafe water and poor hygiene and sanitation. Water, sanitation, and hygiene are essential services that serve as a foundation for quality health and for reducing the spread of infectious diseases. As such, improving hygiene practices by pregnant and lactating women, combined with improved access to water, sanitation, and hygiene facilities in healthcare centers, can indeed improve maternal and child health outcomes in Nigeria. Poor hygiene means infants are regularly ill and are at risk of death, children will miss school, adults are not able to work to support their families, and spend what little money they do have on taking care of sick children. It means patients and health workers are also at risk in healthcare environments, and people's dignity is compromised. By changing their hygiene behavior, people can protect themselves from infectious diseases, stay healthy, increase productivity, and live dignified lives. It is in the wake of this that we consider this project today. Also reflecting on the COVID-19 pandemic, there is no denying the significance of good hygiene and sanitation practices, as I am sure you will all agree with me that there is no better time than now to build on the momentum and intensify efforts to improve hygiene care in Lagos State. Therefore, it is against this backdrop that WaterAid Nigeria, with the support of the Kimberly Clark-supported is implementing this 2-year hygiene promotion and education project to improve hygiene behavior among vulnerable population in Lagos State. WaterAid has been working in several states in Nigeria to accelerate progress in the access levels to water, sanitation and hygiene, and this project will enable us to expand our work in Lagos State. To realize the project objectives, a blend of innovative approaches, including service delivery interventions, system strengthening, and hygiene behavior change interventions will be adopted. We will deepen our relationship in the states by working in partnership with government institutions, local council development areas, and civil society organizations to do the following. 1. Increase awareness about safe hygiene behavior practices among pregnant and breastfeeding women in target communities. 2. Provide hand washing facilities and hygiene kits in public facilities such as schools, community centers, and primary healthcare centers. 3. Carry out large-scale hygiene promotion in peri-urban and rural communities. And 4. Engage with relevant communities in Lagos State to accelerate change by embedding hygiene behavior change in their large-scale hygiene promotion campaigns. This project will consolidate the efforts of Lagos State government in expanding access to these basic services.
Good afternoon all. Permit me to stand on the already existing protocol. My assignment this afternoon is to give us an overview of WaterAid and the Kimberly Clark project. And the title, of course, is Sanitation Hygiene Improvement Project. We are in collaboration with the Lagos State government. So for WaterAid, who are we? WaterAid is an international non-profit organization determined to make clean water, decent toilet, good hygiene normal for everyone, everywhere within a generation. In the 80s or 90s, you will agree with me that if you go to a tap, you open and water will flow. That is normal. But it is not like that anymore. So WaterAid is saying it should be normal. Water should be a normal thing for everyone. And the 3 fingers, what is it representing? It's representing clean water, decent toilet, and good hygiene. So WaterAid, if we raise the 3 fingers, that is what we mean. We have 4 aims in WaterAid. The first one is to achieve universal, sustainable, and safe services in focus geographical area to influence wider change. We are saying that the sustainable goal 6 is talking about water, sanitation, and hygiene. We're following that. And in Nigeria too, there's a focus on water, sanitation, and hygiene. There's a call for Clean Nigeria campaign. We want to follow that. Our WaterAid is working in focused geographical area. We are interested in reaching the poor, the places that are unreachable. It was mentioned earlier that why Ikorodu not or why Ojodu. Ojodu is the peri-urban, while Ikorodu not is the rural. That is why we are working, and that is what WaterAid wants to achieve. The second priority is to prioritize wash across health sector to improve WaterAid around public health. We are focusing on wash in health centers. We want a situation whereby people can go to the health centers and have all the wash facilities available and accessible. a situation whereby the services we are providing does not cause more harm than good to the environment. We want to also support government to ensure that these services that are provided does not cause problem to the environment. We want to increase the quality and quantity of financing. You agree with me that for budgeting, water supply is far ahead. For every budget you get to see for water supply. But in sanitation and hygiene is not much. Where you even find, you just see people just put a lump sum. We are saying that no, the quantity should be much. The quality of the budgeting too for wash should be appropriate according to our work plans. So we have different approaches. We provide services, like has been mentioned. We are going to provide some services, facilities, sanitation facilities in the primary health care and in schools. Also, we build capacity. We are going to be doing a lot of that in Ikorodu and Ojondu LCDs with the staff there. And also our partner, the Ministry of Environment and Water Resources. We want to influence, support government to do their budgeting and whatever they are working in, ensure that due process is followed according to what the state policy says. We're in partnership, we're in alliance, we are working around gender equality. Our approach also is focused on evidence learning and innovation. We come with activity, we come with programs, but we also come with evidence to say the reason why you need to do these activities is because so number of so data mentions the reason. So that's what one of our approaches. Our work in Lagos already, we started work with through the Lagos State Water Regulatory Commission. Thank you, ma'am, for coming. LAWASCO, we signed an MOU with LAWASCO through the Ministry of Environment and Water Resources too in 2021 when we started work. We've conducted a political economy assessment of Lagos water sector, and then we supported the Lagos State officials to Zambia for learning exchange visit. We are presently supporting the Ministry of Environment and Water Resources to review the wash policy for Lagos State. And we are in continual collaboration with LAWASCO and some other wash stakeholders. The project objective is four, as we mentioned earlier, but I'll break them down a bit. The first one is to increase awareness around safe hygiene behavior among pregnant and lactating women in targeted communities. We want to meet these women in the primary health care. We want to discuss the reason why some behavior like WaterAid, and in Lagos State, we are going to be looking at 3 behaviors. The hand washing at critical time, why we need to do that. We are going to be looking at safe excreta management. We are going to be looking at safe food management. And we want to make these women in the primary health care. Why should they wash their hands at critical moments? Critical moments like after using the toilet, wash your hand. After cleaning the child's feces, wash your hand. Before you eat food, you wash your hand. Before you breastfeed the child or feed the child, you wash your hand. Before you cook food or you serve food, you wash your hand. So we want the women to understand this. Research has shown that if those critical moments are observed, water-related diseases are cut off by about 49 to 50%. We want to also make women understand at the primary health care where we meet them, the connection between excreta, open defecation, and their children's food. How a fly can go and perch on an open defecation and go and perch straight to their children's food or even the adult food. These are things that bring about diarrhea, and we have a cycle of sickness. You see women going to the hospital weekly or monthly. We want them to understand that, and that brings about poverty and so on. So we want women to understand that. The second objective of the Kimberly Clark WaterAid project It's a large-scale hygiene promotion in peri-urban, in rural. In the communities, we are going to provide hand washing station. Same in the PAC, like we'll discuss in the PAC, we'll send same information at community level. We'll do a lot of campaign around hand washing. We also want the community to understand that open defecation is dangerous. They need to know that is a community thing. The approach we'll be using is called community-led total sanitation. And why is it a community-led total sanitation? Because it's a community thing. In that approach, 99.9 is a fail. Because if this is a community, everybody is using a toilet, and I am not using mine, we are all not safe. So everybody will need to have a toilet and is using it, so that we don't have situation whereby there's open defecation. When it's dry, the winds blow it. Where does it go to? It doesn't choose the houses of those who have done it out there. It comes back to us. The fly can take the defecation, bring it back to us. We have animals out there that take the defecation that's open, bring it back to us in our water and so on. So we want the community members to understand this and take a decision as a community and say, look, we are going to be open defecation-free community. So this is it for the second objective. The third one is we'll provide hand washing facilities both in primary health care and in schools too, and in the communities. In the schools, we will support rehabilitation of their toilet sanitation facility. This project will not provide water supply, but it will help in rehabilitation or recirculation of water where there is none. For the girls, we want to discuss the 3 behaviors, but with particular focus on menstrual hygiene management. We want to tell the teachers and the girls the dangers of menstrual hygiene, how it can cause urinary tract infection, itching, discomfort. And these are issues that at the end of the day, if it's not well managed, it can lead to fertility problems in the future. We want our girls to see menstruation as normal. We want them to be comfortable when they are menstruating. We want a situation whereby when they are menstruating, they have a corner where they can wash themselves and they can clean themselves and come out and continue with their school activity. We will also train some of the teachers and girls how to have reusable menstrual materials. Okay. Then the fourth one is we'll engage with relevant authorities in Lagos State to accelerate change by imbibing hygiene behavior change on large scale. This is one of it. We are collaborating with partners to ensure that at the end of the day, when WaterAid is away or Kimberly Clark is away, in the budget of Lagos State for every ministry, you are able to budget for WASH and ensure that behavior change that we have mentioned and others will be captured in your budget and it will be implemented in all the communities. Our hope at the end of the day is that while we are working in Ikorodu North and Ojodu, the government of Lagos State will replicate this whole project in another LCD, maybe take us as much as they can and do the same.
Protocols, our chairman have left. I would like to particularly congratulate the 2 chairmen, Ojodu and Ikorodu North. Of course, when Ojodu local was given a clear his own address, he mentioned the fact that they now have 3 PHCs working 24 hours. That's a very good thing in this state. Most of our health services, I know that they are working 24 hours, but for us to add PHCs to it, it's something that is not easy. So, the ULCDS, please help yourself, and Ikorodu North, I am sure the chairman did not mention that fact, but I'm also sure that you also have PHCs that are working 24/7. So on behalf of the Honorable Commissioner for the Environment and Water Resources, Mr. Tuji, may I extend a warm welcome to everyone here present. Today will not be possible without the support of Mr. Governor. Please a round of applause for him. You know that everything that has been said there is made possible particularly because Mr. Governor has given us the go-ahead to implement this project. So another round of applause for him. He did not only gracefully approve the program, but has also approved and funded other important programs and projects aimed towards the revitalization of water sector in the state. I also like to thank our partner and sponsor of this project, WaterAid Nigeria and Kimberly Clark. Our esteemed guest does not need convincing about the importance of hygiene. Instead, you are active stakeholders with whom we can discuss ways to persuade others of the importance of hygiene, water supply, sanitation, and public health. And we agree with me that one of the lessons learned with the COVID-19 is hygiene. I think if there's anybody here that does know that hygiene is the number one lesson that we learned from COVID-19, I think maybe I wouldn't say you should be affected with the disease, but again, it's something that we must know that is the basic thing that we need to do. Someone, while she was presenting a message, she mentioned that each time you want to breastfeed, you have to wash your hand. You want to change anything, you have to wash your hand. In fact, I would say each time you shake hands, you wash your hands. So we're gathered here today to start a vital program aimed at promoting, educating the residents of Ikorodu North and Ojodu LCDA on hygiene. This is to formalize the structured and methodological approach to gaining universal adoption of hand washing and fecal sludge disposal. Behaviors that are expected to reduce disease causing microorganism and parasitic transmission or parasite transmission. The project entails disseminating knowledge and understanding of hygiene practices. That is why I will agree with the gentleman that added to the fact that we would like to have almost all the knowledge, all the body of knowledge that we gather during the process of this project, that it should be shared across all the various entities. It is important because we want to domesticate everything that we have done in this project. So please, whatever we do, let us find a way to itemize it and be able to transfer it to the necessary agency. Lagos State Government, under the leadership of Mr. Governor, through the Ministry of Environment and Water Resources, has been in the campaign for hygiene and public health before today. The ministry has also embarked on the review of wash policy, which is also co-sponsored by WaterAid. And we have had stakeholders meeting, which is to achieve a robust institution and proper institutional arrangement capable of delivering on the goal of access to potable water and sanitation to all in the state. The ministry has also embarked on sensitization of populace on the hand washing and hygiene practice. We have not accomplished all this in isolation. We have done so with the active engagement of several partners, including federal and local governments, as well as WaterAid Nigeria and other development partners. And of course, we have our agencies that are responsible for these laudable projects. Number one is NASWACO, and we have Water wastewater management, and also water corporation. Please a round of applause to them. We also have NGOs that have supported us. We have NGOs to accelerate the development of water supply, sanitation, and hygiene sector in the state. Today, the State Planning and Implementation Committee will be inaugurated and its members drawn from different sectors, sworn in to perform the function of seeing to the successful monitoring of the program while also carrying out advocacy at both the states and at local government areas. I think the major lesson we should know from this intergovernmental committee is we all know that the water sector is a cross-cutting sector. It is not as if you will say because I'm an engineer, I know it all. So it is something that we all need to learn from each other. And I hope by constituting this committee, we will learn from each other and be able to advance the issue of wash in the states. Therefore, we appreciate everyone here, particularly WaterAid Nigeria, Kimberly Clark, and the Executive Chairman of Ikorodu North and the LCA. We also appreciate the presence of my dear sister, the Executive Secretary of NASWACO. Thank you and God bless.